Hi, I'm Dr. Andrew Strauss. I'm a chiropractor who specializes in the conservative treatment of scoliosis. I've been in practice for over 40 years, and my practice is located just outside New York City. Scoliosis testing is a standard part of the well visit that a child goes through when they go annually to the pediatrician, usually at the end of the school year before they would go away for the summer. Scoliosis testing involves a few different aspects. For example, when the person goes to the pediatrician will ask them to bend forward to touch their toes, and he'll sight along the back. If they're a little bit more accurate, they're going to use a tool called a scoliometer. You can see here a picture of the scoliometer, and here's a short video showing the scoliometer testing. If scoliosis screening is done at an early age and the scoliosis is detected, there's a very good likelihood that that child will never go to surgery. This is what the research has shown, and this is why many states have now mandated scoliosis screening for children in the school. This is usually done by either a gym teacher or by the nurse at different ages depending upon the state. We know that scoliosis is a progressive condition. So if that child has a scoliosis when they're, say, 10 or 11 years old, it's very likely that the scoliosis will progress into a larger curve. So if the curve is caught early enough and treatment is instituted, then that curve can be treated successfully, especially when the curve is smaller. And the treatment will only involve exercises. That child will be unlikely to require a brace and can be successfully treated without the brace. While there are three different types of scoliosis that a child can get, infantile idiopathic scoliosis, which happens from birth until the age of 3, juvenile idiopathic scoliosis from the age of 3 until 10, or what's called adolescent idiopathic scoliosis, which happens from 10 until around 18. Remember, the word idiopathic means that there is no single known cause for the scoliosis. The large majority, 80% of these, are going to be adolescent idiopathic scoliosis, and that is what school screenings are geared for. The reason is that the growth spurt happens in a girl around maybe 10 years old and a boy around 12 years old. Here we have a picture of a 5th grade class, and you can see that the girls are in the main towering over the boys, because the girls go through their adolescent growth spurt younger than the boys. This is the main theory as to why girls will develop large curves so much more than boys. Small curves are 50-50 boys to girls. Large curves, some studies say, is 7 times more common in girls. Some studies say 10 times more common in girls. And the reason is that the girls go through the adolescent growth spurt when they're younger, and their postural control mechanisms of their brain have not been fully developed. The boy goes through his growth spurt older, usually maybe 2 years older than the girl, and his postural mechanisms are much more developed, so he's less likely to develop a large curve. Because scoliosis is essentially a progressive condition, most states have mandated that there be scoliosis testing. The time of that testing varies a lot from state to state. So if you want, you can look that up and you can see what your particular state mandates. At this time, according to my latest findings, 37 out of the 50 states have scoliosis testing mandated. In the school system, the testing is typically done by a nurse, and she will have the child bend forward. She's looking to see if there's any kind of rotation of the rib cage. Now, keep in mind that this is only going to be evident in a fairly significant curve. So if the child has a mild curve in their upper back, or really any curve in their lower back, the nurse may very well miss it. And the same thing with the pediatrician. I've watched as my girls have gone to the pediatrician to see how do they scan, and it's done very quickly, so that a large curve would be caught, but a small curve, I don't think they would necessarily catch that. Here at the Strauss Method, our screening for scoliosis includes, yes, the bending forward test, and we use the scoliometer to check it more accurately in the upper back as well as the lower back. We also use digital photography so that we can look and see if there's any high shoulder, low shoulder, the waist being indented more on one side and flat on the other, a shoulder blade more prominent on one side than the other. All these things are going to be indicating a scoliosis. Now, if we see that there is an indication, if we see, for example, a scoliometer reading, a high shoulder, a shoulder blade more prominent, I'll take a single x-ray called a screening x-ray. And then we'll be able to say definitively yes or no. This child does have a scoliosis. Even if it's mild, we're going to be able to see it on the x-ray because the x-ray is really the gold standard for making that final diagnosis of a scoliosis. So let's review what to look for in the scoliosis test. First thing we're going to look for is when the person bends forward to touch their toes, is one shoulder blade more prominent than the other. This is called the Adams forward bending test. Next thing we're going to look for is to see, is one waist indented and the other waist flat? Next thing I'm going to look for is to see the height of the shoulders. Is one shoulder elevated and one shoulder low? Next thing we're going to look for is the hips. Is one hip sticking out more to the side, or is one hip coming in? And the last thing that we're going to look for is, are the arms hanging at the same length? Because sometimes, because the shoulder is coming forward, one arm will hang lower than the other arm. All these things together are going to give us a good picture of, does this child have the postural distortion that may indicate a scoliosis? If the child does have the postural distortions that might indicate scoliosis at a well visit with the pediatrician will often send them for an x-ray. Now, if the child shows up with a mild scoliosis, the advice will often be watch and wait. In other words, do nothing. Wait until the curve gets larger. It makes no sense to me, because why would you have a known condition and then wait for it to worsen before having an intervention? It doesn't seem logical to me. Yet this is the standard of care for mild scoliosis. Here at the Strauss Method, we do not take that approach. We take the approach of being proactive. In other words, we're going to start immediately with an exercise program for that child and stop the curve from progressing, reduce the curve size before the curve has a chance to develop into a larger curve. If we wait until the curve is larger, then that child would need not only a customized scoliosis-specific exercise program, but they would also need bracing. So we would like to treat that child without bracing if it's at all possible. And that requires starting when the curve is smaller.